What does treatment with Spravato look like? Well, treatment with Spravato is very regimented because it is an approved drug, and we're compelled to follow the label that was approved by the FDA. When a patient starts with Spravato, first of all, it's important to know that they must be on an antidepressant medication because Spravato was approved to be used adjunctively or in addition to an oral antidepressant. If a patient isn't on an oral depressant, we can have a conversation about perhaps starting an oral antidepressant so they will meet the criteria for Spravato and therefore be able to be eligible for insurance coverage. The other thing is that the regimen for starting Spravato is very fixed, and there's not a lot of flexibility. Spravato needs to be taken twice a week for the first 4 weeks, and then after 4 weeks, it can drop down to once per week or less, but can't go back to twice a week. So there's an initial phase where it's twice a week for 4 weeks, and then if it's working well, it can be continued at a less frequent level. Both Spravato and ketamine require patients to abstain from driving a motor vehicle, and so there's no difference in that. And both Spravato and ketamine are required to be administered in a clinic like ours. In fact, the FDA regulations require that after given intranasal S-ketamine or Spravato, patients are monitored for a minimum of 2 hours. So patients are going to stay in the clinic for 2 hours, regardless of how impaired they may or may not be, and they aren't able to drive home.